ladies, I just wanted to make this video just to talk to you about the care plans and a few other things with clinicals. Um, Letitia, I know you were with me last semester, so literally this is the same stuff I talked to you about last semester. I just wanted to make sure we were all on the same page. To start with, I know I didn't discuss this in my emails. My plan for these students, for my students going to Gordon, is that I'm going to have them do a head-to-toe assessment on one patient every day that we're there. The reason I'm doing this is because I've noticed that a lot of these students are just pulling their assessment stuff straight from the nurse's notes or the EHR. I want them comfortable with head-to-toe assessments. And I see them in simulation, and I know everybody gets a little nervous in simulation, but they are awful in head-to-toe assessments. So just a suggestion to do that. I sent you the email about the handoff report being done in post-sim. Again, very uncomfortable, and that's some students' biggest complaint as they leave, is that we didn't work enough on that, and that's what they're most scared of. So those forms that I gave you, that is not a must. If you have a better form that you like, or you want to let the student come up with their own form, whatever works for you, that's fine. That was just something I got from a nurse at Gordon. Use whatever you want to do. For the care plans, they are due February 13th, March 20th, April 10th. You have 1 week from that date to grade them. They are due at 11:59 at night. You have 1 week from that point to grade them. Unless something comes up and you need more time, it's not that big of a deal. I just don't want students to not have a grade on their first care plan, especially going into their second care plan, and they make the same mistake on the second care plan they made on the first care plan. I just want to make sure that they understand what they're supposed to do on the care plans. I'm sending this video link in an email. On that email is also attachments for all the care plan stuff, plus a care plan from one of my former students that did really well. So I just wanted you to see a good care plan. Remember, the stuff that I tell you is important to me. I was a pediatric nurse and then an ER nurse. May not be important to you. I know last semester Leticia told me that I don't remember exactly what it was. Something education or something was pain management. Pain management was more important because she's an ICU nurse. You pick what's most important to you and explain that to your students. You are the one that's going to be going over care plan stuff with your students. So you base what I'm telling you and what we're talking about on what you want your students to understand at the end of your 4 weeks with them, however many weeks with them. First thing, there's an assessment sheet. They must do the assessment sheet with every care plan. If they do not, they lose, I think, 5 points. The rubric that you see that I attached to that email is also attached to the care plan grading in the Georgia View. So if you want to grade it online, you're more than welcome to. That's how I do it. If you want to do, I know Letitia last semester printed them out and graded them and then handed it back to the students. That's perfectly fine too. Just make sure that the students upload their rubrics into Georgia View, so that and you're just going to have to put the points in Georgia View, so that when I go back and I see, oh, well, this student made a 23, I have a rubric to prove why they made a 23. That rubric is set up out of 100 points because this semester they'll have 3 care plans, so they're worth 25 points apiece. Next semester they'll only have two care plans, so they're worth more. So it's just easier than trying to figure out the point system, is just to do it out of 100 and then just multiply that by 0.25 and it'll tell you exactly how many points that will be out of 25. Just looking at the care plan, sorry, I'm looking at my notes here. Just looking at the care plan, the primary medical diagnosis is whatever they're admitted with or whatever they're diagnosed with within the hospital. If they come in for shortness of breath and they're diagnosed with pneumonia, you probably want the students to do pneumonia. And they may have several medical diagnoses. That's normal too. Medical history, if they have a lot, I just tell my students to do just what pertains to this visit. If the patient is in for COPD exacerbation, I don't care that he had to have a tib-fib fracture repair in 1983. I don't care. I want to know just what has to do with this visit. The discharge instructions, they must have 6 bullet points, so very clear. And the students must create. So if it's, we'll go with COPD exacerbation, follow up with lung doctor in a week. Continue using nebulizers as ordered by doctor. Discontinue smoking, whatever. They need to use their critical thinking skills to come up with that. Pathophysiology, they must write what's going on with the patient. What is causing pneumonia, COPD, COVID, whatever. And they must include symptoms, and they must either highlight or underline, whatever will work, so that we can pull those symptoms out of what their patient's having. Medications, you see that they're just going to pull that stuff straight out of the drug book. But the patient response, I want to know on a lot of them, we'll say antibiotics, insulins, blood pressure medicines, anything that's going to change something. I want to know how it's changed. So if I see a nurse give a patient, I don't know, 20 units of insulin, I want to know what the before blood sugar was. So blood sugar before was, I don't know, 304. After was 180. I want them to understand what that medicine's doing. Same way with blood pressure medication. Now, if it's something like, lisinopril 10 milligrams, they're probably on it at home. So they can just give me blood pressure reading and just say that it's a home med. But if they're getting something because their blood pressure's high and we're giving a medicine to bring it down, I want to know before and after blood pressures. Labs, students have a bad habit on that. I think it says significance to patient on that one too. Whatever that last line is, they have a bad habit of saying antibiotics will reduce infection, or it's given for infection. No, I need to know what kind of infection this patient's having. Even if I know this patient has pneumonia, I need you to say that. Excuse me. This is because this patient has pneumonia. And I want to know, if possible, if they've been in the hospital for a few days, I want you to show me white blood cell count. White blood cell count went from this to that, shows that this medication is working. Or I'm sorry, that this lab is improving. Just so that it makes sense to say what's going on with that patient. On the labs, they are more than welcome, if they have a lot of labs, to do abnormals only, but I always tell them they must have at least 10 labs on there. On the radiology, that's one of those things that y'all are probably going to have to jump in, because these students have most of them have never read an x-ray report or a CT report. So you're really going to have to show them how to read that and comprehend it. Because we all know that a lot of that is stuff that's going to be mumbo-jumbo to them. They're not going to understand. So just help them with that. Diagnoses, just like any other care plan, have to have 3 NANDA-approved diagnoses in priority order. That is where it may be different according to where you worked and what your specialty is. So whereas in the ER, pain is not a big deal to me. If you work ICU, it probably is, because long-term pain we know is going to raise blood pressure, raise heart rate, can slow them from being able to understand what you're trying to tell them, all that stuff. So pain is a much bigger thing. Being deficient in knowledge is not a big deal in the ER. You may say that it's different according to where you worked. But you can just help students understand why you say what you say. The goal, you have to have a goal, and was the goal met or unmet? And the goal, it must be within their 12-hour shift. So in my 12-hour shift, this patient will ambulate 4 times. It can't say by discharge unless they're being discharged during that shift. Just because we won't know if it's met or unmet. So in the outcome, the goal outcome, they must say goal was met and explain why. Goal was unmet and explain why. Must have those words. And it says all this in the rubric. So just tell your students, follow the rubric when they're doing these care plans. Subjective and objective, I have a certain number in the rubric, and I don't remember what it is. But you go with whatever helps, whatever works for that patient. For example, if I have a nurse, if I have a student in ICU, and this patient is intubated, there's not going to be a whole lot of subjective. You're not going to be able to ask him if he's hurting or if he's doing this, that, or the other thing, because he's going to be knocked out because he's got a tube down his throat. So those may not have any subjective, and I'm always okay with that as long as I know that about the patient. And objective, you'll probably have quite a few. That's completely normal. For the interventions, I tell them they need to be meaty. Don't just tell me. I'm trying to think of one. Don't just tell me that the patient to give pain medicine as ordered by the physician. I want to know exactly what pain medicine. I want to know exactly when you can give it. I want to know other stuff. Let's say they're using acute pain, I want to know other stuff you can do for that pain. Don't just tell me medicine. There's lots of other solutions for pain, and they know that. So they need to tell me other stuff. It needs to be very in-depth so I can see point by point that they understand how to take care of this patient. The rationales, they're going to pull from the book. I only allow my students to use 2 quotations. The rest of them they must put in their own words. I don't need to know what the book said. I don't need you to puke up what the book says. I need to know your knowledge of it. So I need you to take that and put it into your words so that it makes sense to you, and you're going to remember it. They must do in-text citations for pathophysiology on the first page and for the rationales. And they must have a reference page. Again, just tell them to follow my rubric because it is very clear and it will tell them step by step exactly what to do. If for any reason you have any questions, please let me know. I will be happy to answer them. And if you have any problems with grading rubrics, have any questions, please feel free, once we get the first care plans in, that I'll be happy to sit down and show you what I would say of the care plan. But again, it may be a little different than what you say, which is perfectly fine. But again, if you have any questions, just email or call me. And if you have any problems on Monday starting clinicals, just let me know. And we will. The first day is always kind of hairy, so just be ready for it. But it'll get better after that. It's just students trying to find y'all, and y'all trying to find students, and nurses, and everything is just kind of hairy the first day. But it gets better, I promise. Did hear from, and I did email this to you, did hear from Karen yesterday that you don't have to do temperature logs anymore. They just have to self-check. So that's good. Not having to keep up with anything else. But if you have anything else, just let me know. Thanks. Bye.